Welcome to this week's edition of the Health Department Roundtable. I'm your host, Chris Schultz, current chair of the Board of Health, and with me is our public health nurse, Lindsay Wright, and our health director, Marty Golightly. Hey, guys.
What's happening?
Afternoon.
We had a really big day in Abington yesterday. You want to talk about all the awesome things we had going on?
It was pretty cool, right? We had our second educator clinic, and we had the lieutenant governor swing by and walk through, and to be honest, we weren't really sure why she was coming, but we did want to take advantage of that time to present what we at the local level are doing and what we are very good at. So we were able to give her a tour and show her around, and hopefully that will lead to a light being shined on local level administrative efforts for the vaccine. And if it gets us one extra dose, then it was a success. And our yesterday's clinic was potentially the last large one we'll do in Abington, which is kind of heartbreaking. So I'm glad she was able to come and see that one. And that was the second educator clinic. And those are the doses that DPH sent us like a month ago and told us to hold on to them so we can finish out the series, all of the second series that we started for the patients we've done in the town. So if that was the last one large-scale clinic we get to do in town, I'm glad it was a success. Thank you for everyone for coming out. Thank you again to all the volunteers, to our firefighters, to our nurses, to our MRC people. We love you. It was awesome. And I mean, you want to talk about a large amount of people stepping up to the plate to get these things done, to get these people vaccinated. It was a joy to be around. I just wish we could do it more often.
Yeah, I've known from personal experience, whenever you have an event that requires that much coordination, it's usually rife for issues. And the 3 times that I've been able to come down and spend any length of time at one of the clinics, you guys are the A-team. Everything is running smooth. Everybody's happy. Great to see. We
take a lot of pride in all that work we do.
Lots of planning.
So this was potentially the last large scale. You are continuing with the homebound.
Yes.
Thoughts?
Yep. Lindsay, how many? We have a laundry list due next week, right? That you're going out?
Justin and I will go out, Tuesday, I believe it is. We're going to do 30 homebound residents. And then on Wednesday, myself and one of the other paramedics will go out and finish up second doses of another group of homebound residents. And we still have a few left that I've left messages for. So if you know of anybody, or if you're looking for and you qualify for a homebound vaccine, please call and we'll get out to you.
If you have mobility issues, give us a call. We have Johnson & Johnson for homebound vaccination efforts. If you have mobility issues, give us a call and we will put you on a list. And DPH has asked Abington to act as kind of a hub for the homebound. How do I want to say this? Our homebound storage for the rest of the surrounding communities, Abington is acting as kind of a hub for that. So we have Johnson & Johnson for that. And if you have mobility issues, let us know so we can get you on that list and we can send out one of our crack teams of Lindsay and our EMS director, Justin, or sometimes one of the school nurses and one of the other paramedics will go out too. Please let us know. If you have mobility issues, it makes it very difficult for you to get to Gillette or to where else, Hines or whatever, wherever else, let us know. We want to come to your house if we can.
And just a reminder for folks, the number for the health department is 781-982-2119. So don't be shy. They're there to help you. I guess we should mention, we usually start with taking a look at our numbers and kind of skip to the more exciting part of our episode today. So just to touch base, where are we currently with numbers in Abington?
We have 36 active cases and 42 individuals quarantined related to an exposure to one of those active cases.
That's quite a significant decrease over the last 2 weeks. So yay, us.
Whatever you're doing, continue doing it.
But boo the state. The state reported almost 2,200 new cases last night at 1,700. And they also added a new interesting breakdown to the dashboard. They did age ranges every 5 years for the vast majority of the ages under 29. And you can see the graph is it's almost twice as many cases for the ages to 20 to 29 of every other age group. So hopefully coming next week with that age group being able more access to the vaccine, that number will also shrink. So my point in saying that is that we have to continue to remember that there's a lot of asymptomatic spread. Yeah, those people probably aren't going to get as sick as the rest of the people who, if they did get COVID, they'd be in the hospital or not. But it's definitely not an old person disease. It's definitely not a disease for the sick. It affects everyone, and the numbers back that up. Between the ages of 20 and 40, there were a little over 1,100, almost 1,100 cases in the past 2 weeks. And that's statistically significant. That's not, that's us paying attention to the data and seeing the trends. So our under 40 to about 20 population are usually otherwise healthy. Please take care of yourself. Please make sure that you're doing your part to wear your mask and wash your hands so you're not spreading it to those who were unable to get vaccinated or to our kids. Please.
And starting Monday, right, the general population is eligible for vaccination?
I believe it's the 19th.
19th.
They give 2 weeks to the 55 and older with one medical comorbidity and essential workers. And also this week, Pfizer submitted its results to the FDA for adolescent use over the age of 12 for their vaccine. So we could be in a position that 12 and older can get the vaccine before the next school year. We don't really know, and it's really difficult to predict the time frame for that. So I want to assure everyone that while it's not got a lot of news from the state, Abington has a plan for kids. We have several plans. We have talked about it because that's what we do. We like to plan ahead. We like to be proactive and not reactive. So if that is a thing, we would also like to do that locally. I know a lot of the families in town would prefer to our school nurses and our nursing staff around the town have access here to give that shot to the kids. So we will continue to aggressively advocate. You knew it was coming, to aggressively advocate for local delivery of the vaccine.
Yes, I think I was telling Lindsay yesterday, my daughter is the only person she'll take a shot from is Lindsay. So
as soon as I have the doses to do it, she'll be first on my list.
All right, and as a reminder to people, I know we posted on our Abington Board of Health Facebook page, there is a link on the mass vaccination site where you can sign up to be notified when you're eligible and then make appointments from there. So you can get yourself on a virtual waiting list as things start to progress, because I'm sure there's going to be a high demand as more and more people are able to get the shot. So.
Yep.
All right, that's all we have for this week. Lindsay, Marty, I want to thank you again, not only for joining us for these updates, but for all your incredible hard work. You guys did a fantastic job yesterday. It was great to see.
We are part of a great team, and we couldn't have done it without them.
We're very lucky in this town.
Yeah, really are.
Thank you, everybody, and we'll see you next week.
See you next week.